Are you a healthcare professional working with breastfeeding infants? Wish you knew more about assessing and treating tongue ties? Earn continuing education credits and transform your practice with the Professional's Guide to Tongue Tie in the Breastfeeding Infant. It's perfect for any practitioner who works with infants and their mothers, especially those working through feeding challenges. Learn to identify who needs treatment, build a qualified care team, and provide holistic care options. Discover the ins and outs of frenotomy, including procedure preparation and best aftercare practices. By the end, you'll be confidently supporting breastfeeding families armed with the latest protocols and be part of an interdisciplinary community of experts just like you. Tongue ties are nothing new, but the right way to assess and treat them is. Ready to make a real difference? Join now and become a tongue tie expert. Sign up today at tonguetieexperts.net/professional and become the evidence-based resource that your community needs. To show my gratitude, I'm offering you a special discount as a podcast listener. Use code PODCAST40 to save 40% off today. You're listening to the Tongue Tie Experts podcast, a weekly program providing information and support for those families impacted by tongue and lip tie and the professionals caring for them. I'm Lisa Paladino, a midwife and a lactation consultant with over 30 years of experience. If you are a parent looking for answers or a professional who is curious to learn more than what you learned in school on this topic, welcome. This podcast is for you. A gentle disclaimer. Please do not consider anything discussed on this podcast by myself or any guest of the podcast to be medical advice. The information is provided for educational purposes only and does not take the place of your own medical or lactation provider. Thank you. Hi, everyone, and welcome back to this week's episode of the Tongue Tie Experts podcast. I'm your host, Lisa Paladino, and I don't know if you hear my excitement in my voice because I'm very excited today because not only is my guest part of the tongue tie world, but she's also a podcast host herself. So we have lots in common. We both run our own small businesses, and everybody knows how much I love women-owned businesses. But so let me tell you about her. Her name is Meaghan Beames, and Meaghan is the founder of the Beames CST Training Center, offering tailored global learning for health professionals. Her mission is to ensure every family in North America has access to qualified craniosacral therapists to help their babies cope with colic, latching issues, and all the growing pains that can make life with a newborn harder than it needs to be. In 5 years, she's treated over 700 babies, taught more than 100 health professionals craniosacral therapy, and built a thriving practice in Toronto with multiple practitioners working under her. Her knowledge goes beyond just the practical applications of bodywork and spreads out into being a leader and growing a business. She's also the host of her podcast. Welcome, Meaghan. And what's the name of your podcast?
The name of my podcast is the My Baby Craniosacral podcast. So My Baby is the name of my business as well in Toronto. So it's just, and I was able to get it trademarked. So I love it.
Yeah, it's beautiful. So welcome, welcome, welcome. And
thank you.
For those listening, this is a little different because we're recording not only for my podcast, but also for Meaghan's podcast, the My Baby Craniosacral podcast. So we're going to be asking each other questions. So you're going to learn about the both of us on this podcast. So Meaghan, thank you so much for being here. This is just an honor and it's going to be fun.
Lisa, thank you so much for having me. I love talking about this, and tongue ties are so prevalent in the work that I do that I feel like tongue ties and CST, there's like a perfect marriage there.
Mm-hmm. Yeah, absolutely. And I know, and I've been saying this since I started networking and referring back and forth with craniosacral therapists in my area, I see so much success with tongue tie treatment in babies who have had CST.
Yeah.
And even their mamas who have had CST, right?
Yes.
Absolutely. And I feel that, let's put it this way, treatment doesn't always mean release of the tie, right? And I just had a heated discussion in a Facebook group about this where someone said, go get that released. And I was like, wait. So treatment doesn't necessarily mean release. First, we do everything we can, if possible, making sure that the tongue tie is the problem. And part of that could be releasing tension in the body, which is perfect for with CST. So
absolutely. And I would love to be in that heated debate.
Okay, I'll invite you.
Bring me in.
So for those listening, I'm sure you can relate to this. There's always that one person that just says, oh, just release it. Oh, just release it. And I was like, no, we have to have a functional evaluation. And then someone else said, well, you can't always have a functional evaluation. And
that's true. Yes.
It's true. But I don't want anything said out loud that someone will read that isn't aware. Someone will read the statement that says the baby's going to need a release anyway, or just do the release, because we have to be careful what we say on social media.
Absolutely.
In platforms like this, to make people that don't have the background we have to be aware of the entire holistic treatment of the mother-baby dyad. So that's my stance.
Yeah.
Go ahead.
I was going to say, like, letting people know that a functional evaluation beforehand would be preferable, but because it's not always accessible or even feasible, getting the tongue tie release without one is not optimal. But sometimes if that's the only way you have, then getting it done is better than leaving it.
Yes, absolutely. Yeah. I just, especially since the last year or so, there's been so much criticism about our field that I want to be very cautious, because I feel that the people that don't get guided treatment are the ones that are speaking loudest against, I got the baby's tongue tie clipped and it didn't make a difference. Well, maybe the tongue tie wasn't the problem. Maybe there was something else going on,
Or maybe there's a combination of.
Yes. Yeah, absolutely.
And you're only addressing one part of the combination.
Mm-hmm. So let's go back, because we started getting right into it, but let's go back. And for those who don't know, what exactly is craniosacral therapy?
So craniosacral therapy is a very gentle, hands-on modality that treats all parts of the body. So a lot of people will say, oh, craniosacral, that's the head and the sacrum, which is not the case. We work with the fascia, the fascial system of the body. And so craniosacral, the reason why it's named that is because there is a fluid that runs from the cranium to the sacrum in this like up and down wave-like motion. And so this fluid circulates throughout the entire nervous system. And it's what helps us to heal our own body. This fluid, it helps to provide drainage of waste, meaning if we've got like dead cells in our body, how are we going to get those dead cells out? Mm-hmm. And so this craniosacral rhythm is incredibly important for self-healing capabilities. And if our fascia is tight, our self-healing capabilities are impaired. So what we do with craniosacral is we find areas of tightness, we release them very gently, and And so the body's self-healing mechanisms work better.
Mm-hmm. So I love that you made that differentiation, because before I knew what CST was, I was hung up on that cranial sacral.
Yeah.
You know, that's it's not the ideal term, you know.
Yeah.
Honestly, I
Oh, I
found that to
totally
be
agree.
a stumbling block, because it's like we should find a way to rename it or something. But no. But I do the aspect of the waste products. And now that you had me thinking, we're talking about the nervous system.
Mm-hmm.
And we're thinking about like chemical reactions in the nerve cells, right?
Mm-hmm.
I mean,
Yep.
so those the chemical garbage, or what you might call, for lack of a better, more sophisticated term, has to go somewhere. And if it's not eliminated, it builds up and causes more
That's right.
tension, right?
That's
So
right.
I find that fascinating. I've always loved, bio and chemistry and stuff like that. So I love to get a little geeky on that. But then this seems to me, and I've heard this before, like it's a woo-woo kind of treatment. And I'm okay with woo-woo treatments,
Sure.
because mind-body connection is real.
Mm-hmm.
And I have said to people, because I've seen amazing results from craniosacral therapy in my own life and in patients of mine. I always like to say to parents who are kind of on the fence about, what is this? My doctor never told me about it, and wondering what it's all about. I like to say to those people, sometimes we have things that shouldn't work, but they do. Like from a like trying to figure it out kind of thing. And one of the things I put into that classification is homeopathy. Right? Homeopathy should not work. There's no real scientific basis why it works, but it does. And CST has a little bit more scientific basis behind it than that.
I would actually say that it has a lot more scientific basis.
Okay, great. So
Yeah, like a significant amount more.
That's good. I don't mean to insult you.
No, not at all.
I
I'm
just feel
trying to
like
change the narrative.
Yes, absolutely. But even from watching a treatment, it's so gentle and the touch is so light that it doesn't look like it's doing anything, but it is. That's what I mean by that. It shouldn't work, but it does.
Exactly. And so I'm going to just kind of explain a little bit why it does work.
Please.
And so there is a lot of scientific evidence around the benefits of CST for not only babies, but children, adults, teens, everyone of all ages. And so the reasons why it does work is because fascia is a protective tissue. So for people listening, if you don't know what fascia is, it is a connective tissue, meaning it's what kind of holds our body together. It connects parts of our body, makes sure that it doesn't just turn into a puddle on the floor, and it's protective, which also means that it can help guard areas. So guarding means it tightens, but it doesn't release very well because of fear or repetitive motion or an injury or that type of thing. So when it's under stress, whether it's like blunt force, maybe like a car accident, or you fell down the stairs, or you got hit by something, in the air, it just came and hit you, that connective tissue protects what's underneath it when it's under this stress. It could also be traction. So maybe you got pulled too hard, you dislocated your shoulder. Or when, in terms of babies, perhaps they were forceps or vacuum, or they needed to be pulled because they had shoulder dystocia. This connective tissue tightens up, but it doesn't release like a muscle does.
And as a midwife, I will add, even the position in utero, in the uterus, even if there's no trauma during birth or no apparent trauma during birth, I have witnessed infants who had tightness just because, and I could associate it with the position they were in utero, because I was at their birth or took care of them during pregnancy and birth, and then saw what I saw outside.
Yes.
and it translates. And I talk about that a lot about my own grandson. He was in a
Yeah.
very awkward, stuck position in utero, and he had a hard time going into labor. Once he decided and found the right path out, it was quick. But it was, and my daughter may not agree that it was quick, but it was quick for a first baby. And he had tension patterns that related to his position in utero that he still has today. As a matter of fact, they're going to see their osteopath who does CST this
Yep.
afternoon, and he's 3 years old. He's still getting treatment. So
Yep.
it doesn't necessarily have to be an obvious trauma, but trauma is more obvious, right?
Absolutely. Yes, exactly. So it doesn't have to be, a traumatic situation. Just like you said, it could be positional. And I have a baby I saw yesterday who was a planned C-section. And mom just said he was always stuck in the same position. Like he never really moved a whole lot. And he's now a month old and continues to be in this stuck position. So not a traumatic birth, like,
Right.
and still his shoulders and tension between his shoulder blades are very tight.
Right.
So yeah, exactly. It could just be, and repetitive motion is also stuck motion.
Yeah.
Right? Like, so it's not
Yep.
just like people think repetitive motion is you're just constantly digging a hole or, throwing a baseball, but repetitive motion could just be your shoulders are scrunched and you're just constantly trying to
and
get out of
bent
it.
shoulders and bent looking at your phone, right?
Head down. Yes, exactly.
Do you know what? I had my own experience, and I have a lot of experience with craniosacral and helping me and stuff, but I remember once somebody asking me, because I always had a very difficult lower back situation. Let's just put it that way. Always had tension in my lower back. And somebody finally, as an adult, asked me if I remember any traumas as a child. And I remember, and if you can remember something, it must have been pretty bad. I remember falling down the basement stairs at my aunt's house, all the way down, bumping. The entire, and I'll never forget. And there was no rug on the stairs. It was wood stairs. And I was sore for a long time. And I carried that tension pattern for 30 years.
Absolutely.
So it's things that we think, oh, they fell, but they're fine. They may need working out.
Yeah. And so I'll get back to the reasons why CST works is because this fascia is protective. It doesn't release very well because it's like, oh, this is my job. I'm doing my job. See, look how good I am at doing my job. And then you try to either stretch it. It's going to continue to protect. It's going to say, no, I'm here to protect things. Whereas if you say, hey, you did a really great job. Thank you for doing exactly what you were supposed to do. You can take a rest now. So with that really gentle encouragement and guidance, it can say, oh, I'm safe. I can let go.
Oh, that's beautiful.
Yeah. And so there is even evidence around that, around, does fascial stretch work better than craniosacral techniques where it's just like really gentle and really soft? And the softer, the more encouraging but not forcing of the fascia is where they see a lot of the benefits.
That's really interesting. It's fascinating. It's almost like you're giving the tissue permission
Absolutely.
to be where it wants to be, right?
Absolutely. The tissue is always looking for optimal positioning. Always.
Yeah.
It's always looking for that.
And one of the things that I say, and I always say, I talk about body work as a person who's not a body worker, but I've had enough, I've taken trainings, I've interviewed people, I've been at seminars and conferences and learned all about this because I think it's really important. Interdisciplinary learning to me is where it's at. In my own course, I don't gatekeep. If you take care of babies and mamas in any capacity, you're allowed in my course. Like a lot of lactation professionals only let lactation consultants in the course. And I feel like most people are never going to see an IBCLC. So welcome. Everybody come to me, learn what you need to know so you can help more babies and more mamas, right?
Yeah.
But so in my view, I always say if there's tightness somewhere, there's tightness everywhere. And I don't know who to attribute that quote to, but I know I heard it from someone else along the way. And that's because of the fascia, right?
Yes.
Yeah.
And tensegrity.
Okay.
So the science around tensegrity is where a bunch of like lines, crisscrossing up and down. And if one area is tight, let's say your left hip is tight, well, that line has the lines for that one can go up, directly up. It can go diagonal. It can go down. And so that tightness will then pull the fibers that are directly up, directly on an angle, directly down. And so then it's going to then cause tightness on the opposite side or wherever that end tissue is. So exactly that. If it's tight in one area, it's tight everywhere.
Yeah. So I had the most interesting experience when my first craniosacral therapy session on myself. And I had to fill out a complete history, but you don't always remember everything to write, right? So we're halfway through, and it was my friend Jackie Hines. I'll give her credit. She's a PT and a CST provider in New Jersey. And she said to me, Lisa, do you have trouble with your left eye? And she said this to me when she was down at my hips.
Mm-hmm.
And I was totally freaked out because I had eye surgery as a child. I didn't put that in my history. I didn't think that had anything to do with anything. But I was born with strabismus, and it wasn't corrected for a really long time. And I have a pull, and what she diagnosed is she could feel a twisting of my entire fascia, starting from my left eye, going through my hip, which it just made so much sense to me. Like, it was like connecting dots that I never knew I needed connecting, and I had such relief and such a release after that treatment.
Yes.
So that's an example of how it's connected. But for babies, we see things like they have a CST treatment and all of a sudden they're pooping every day, or, do you know what I'm saying? Like,
I know
that everything starts working. Everything starts working. So what other things do you see in babies that all of a sudden, are like clicked on after?
Meeting milestones. Yeah. Babies who hate tummy time within either one or two sessions love it.
Yes, I've seen that too. Yeah.
And that the fact that a baby is meeting a milestone or getting closer to meeting a milestone at an appropriate age is also a sign of better brain development.
Yeah.
And in the first year, brain development is incredibly important for the rest of their life, barring any, serious head injuries. But the fact that this baby might not meet milestones, and I don't want this to be fear-mongering or anything, but the fact that they're not meeting milestones is pretty telling about brain development.
Right. It's red flags, right? Like we were taught that. I know even back in nursing school, I was taught, if the baby's not meeting the milestones, it's a red flag for developmental issues. And now they're like dumbing down the milestones.
I know.
It's crazy.
It's fascinating.
It's crazy. It's like,
so, and the reasons why a baby might not be meeting milestones might not be because they don't have good brain development. Brain development is created by movement. So they're not meeting milestones because it doesn't either feel comfortable to do those movements, or they don't even have access in a way to feel stimulation to encourage the reflex to happen. So remember, we talk about the nervous system. If there's tension along that nervous system, sometimes the messages from the brain to the end organ, which is the muscle, maybe it's not very clear. So it's not being sent to the muscles, or it's not being – a reflex is a very quick transaction between muscle and – or touch receptors to the brain and then back. But so it might not be a very clear message. And if you don't have a clear message, then you don't have strength, or you have hypertonicity. So it's like really, really tight. But a really, really tight muscle, right? The babies who are like, oh my God, look how strong they are. Really,
right.
Is not always a good sign. And it doesn't always mean strong.
Right. It's just tension.
Tension in the fascia.
Yeah.
So fascia and muscle are two different organisms, really.
Yeah. So the baby that can roll over from birth, which is one of my kids, not necessarily healthy. But you know what? It's really strange because there's exceptions to every rule. that
sure.
child has no concerns. Like, he's a grown-up now, and he was an athlete, and he was amazing. My kids all walked too early. I did all the wrong things, because we're going back. My kids are grown-ups now, and I didn't know anything. They were in walkers, which isn't recommended anymore, and all the things that we don't do, I did with my kids. They slept on their bellies, imagine, and they're all
My
alive.
babies
They're all
slept on their
healthy.
bellies.
Yeah, I know. That's another story. But yeah, all the things, and he was okay, and then he's fine. He's amazing, actually, healthy physically.
Yeah.
And
Does he
but
get
then
migraines?
no, nothing.
Oh.
Nothing. He's
Does
the
he have sinus
healthiest,
issues?
best. Nothing. I'm telling you,
Oh,
he's
wow.
like, he's got soreness from a car accident. That's where he had an injury, a car accident. But other than, as a grown up, so other than that, whatever.
Yeah, and I
It's
think that's
weird.
why I
It's
say
weird. It's
is
like
that
there's
I
no
don't want it to.
absolutes, right?
Yeah, I don't want to be like fear mongering, be like, oh my God, your baby's not meeting milestones, or they're rolling over too soon. Oh my God, it's crazy. They're going to be awful forever. It's like
Right.
you don't know,
Right.
but there's no harm in helping them out in this time.
Right. And this is a do no harm modality. You can't do any harm with CST.
If you're using the techniques the way they are intended to be used, there is no harm. There is only good.
Right. That's what I love, because I love, like, the safety.
Yes.
The safety aspect of it. There is no way to hurt someone if you're going to someone who knows what they're doing with CST.
Yes. If they are doing the softest touch, what I like to say is the only thing that could go wrong is nothing. Nothing.
Right. Okay.
You see no improvement. And is that wrong? No, not necessarily, because sometimes we don't know what has improved. It could be something so minor. It could be something so small, but because it's not the change that we are expecting or wanting to see, we brush it off.
Right. And that slight change could be paving the way for bigger changes down the road.
Exactly.
Right? Yeah. Clearing those pathways.
Absolutely.
Yeah.
Because once we release a tissue, it's almost constantly capable of finding better balance. I'm not saying symmetry in the body, because our bodies are not symmetrical, but better balance in the body, finding better ease, better motion, better mobility. And it's almost always going to be looking for better.
Tongue-tie cases can be confusing, but what if you had a place to ask questions, learn from experts, and connect with professionals who truly understand? That's exactly what you'll get when you join Tongue-tie Experts Insiders. It includes monthly online meetups with me, Lisa Paladino, expert guest speakers sharing the latest research and best practices, a private community of other professionals ready to support you every step of the way. For just $19.99 a month, you'll never have to navigate tongue-tie cases alone again. Join the community today. Your future self and your patients will thank you. Sign up now at tonguetieexperts.net/insiders. Yeah. So let's talk about tongue-tie treatment. And as we started out saying before, that treatment doesn't always mean release of the tongue with a frenotomy. When I see a baby, let's put it this way. My wish for every baby is that they got evaluated by every type of provider. I always say CST, like we just said, it can't hurt. Let's try that first. Let's see what's going on for the baby. Sometimes it's the mom that needs the treatment.
Yep.
Let's put it this way. Do you feel that there are many babies who can avoid frenotomy using the techniques that you teach?
Yes. Not all.
Right.
I will definitely say that. Not all can avoid frenotomy. My goal is to get them as far away from that type of procedure as possible, but I'm not against it.
Okay.
I understand the necessity, and I and I strongly believe in it.
Mm-hmm.
But I want to avoid if possible.
Yes.
And so when this baby when someone says, oh, there's a possible posterior tie, the word possible posterior to me sounds like tension.
Mm-hmm.
And that sounds like someone's digging under the tongue looking for something.
Mm-hmm.
And so for me, if they're digging under the tongue and they're looking for something, they're looking for I'm going to quote unquote use air quotes on this one, an excuse.
Mm-hmm.
I want to know, okay, why isn't that tongue working?
Right.
What is causing this dysfunction? What is causing this tension? And looking at the tongue is not going to give you the answer.
Oh, I love that. That's so true. So true.
The answer is within their head shape. Head shape
Mm-hmm.
strong is a huge contender
Mm-hmm.
for tongue dysfunction and oral
Mm-hmm.
dysfunction. Looking at their body. So, do they have even the tiniest bit of torticollis or C shape, this curvature to their spine?
Mm-hmm.
Is there tension in their hips? Because if there's tension in their hips, there's tension in their mouth. Is there asymmetry to their hips? If there's asymmetry to their hips, there's asymmetry to the mouth. Are they throwing up every day? Like, are they
Mm-hmm.
excessively spitting up? Yes,
Mm-hmm.
that there's tension in the actual stomach muscles that
Mm-hmm.
could be pulling and drawing that tongue down, making it look like a tongue tie.
Mm-hmm.
Do they have a herniated belly button? If they've got a herniated belly button, not all babies do. They could have an outie. Doesn't mean it's herniated. But if there's a bit of an outie at like a month or 2 months old, when this posterior tongue tie is kind of, being diagnosed, then there's also digestive issues. So these
Mm-hmm.
digestive issues is a sign that there's tension within the abdomen
Mm-hmm.
that could, again, be causing tension in that tongue, tension in the throat, tension in the back of the throat, the roof of the mouth.
Mm-hmm.
So what we're doing is we are looking for all of the other reasons within the body why this tongue is presenting as a possible posterior tie.
Right.
And we find those areas, we release them, and the tongue has more mobility. It's no longer being pulled down by tissues within the abdomen. And so it's free to go to the roof of the mouth. Now,
Mm-hmm.
if it's not within the abdomen, then we're going to look at the head.
Mm-hmm.
Is there a high arch palate?
I was just going to
So,
mention that.
oh
Yeah.
gosh.
Yeah.
And this one
Mm-hmm.
to me is like, oh, well, it's a tongue tie. There's a high arch palate. Well, did you know that it's not always the tongue that is, in charge of creating a lowered palate? It could be tension along that spine.
Mm-hmm.
So the tension in the spine, that because the sacrum is connected to the back of the head, the forehead, and the roof of the mouth, if there's tension there, it can actually be pulling that roof of the mouth up. Or
Mm-hmm.
let's say the head is kind of compressed medially, like it's really narrow. That can cause a high arch
Of
palate. And then the
course.
tongue, even though the tongue is fully mobile or not tethered, it can't reach the roof of the mouth.
Right. So I like to say that the definition of a tongue tie is not something we look at and see. I won't even let pictures of tongue ties in my, I run a lot of Facebook groups for support groups, and I won't let somebody post a picture and say, does
Is
my
this
baby look tongue tied? Because it's not what it looks like, it's how it functions. And then we have to say, why is there dysfunction? And go through the steps, like you said. Yes, is there sometimes when I will say, you know what? This mother wants to breastfeed. The baby cannot latch at all. There may be something else going on, but she can't feed her baby. We're going to have to do a release sooner rather than later, but with the caveat of letting them know this is not going to be the be all and end all of treatment. You may need another release. You may need a lot of body work, whatever body work is available for them. And not to go away after the release, so it's still treatment. It's release with guidance. And this is what I teach to my students. Let's not run to release unless we have to. And if we have to, let's make sure we're providing enough education for people to understand that this is to give a holistic view to that infant mother dyad. The other thing that people don't look at a lot is what's going on for the mom,
Yeah,
right?
exactly.
Like I have a longtime patient. I took care of her for her first baby, and now she's had a second baby 8 years later, and trying to have a more successful breastfeeding relationship with this child. She had an emergency C-section after months of preterm labor. Baby was in the NICU. She wound up with a wound infection. Like, this poor woman was not in a place that she was ready to hand her baby over for a procedure and then help the baby recover. She needed healing first, right?
That's
So,
right.
and this is a holistic dyad. So we have to look at mother too. And as a midwife, that's my jam. Like, let's make sure mom is okay and not just treat the baby. I've had so many moms who are too depressed to know, like, to absorb the education that we're doing. They're just
Yeah.
in this state of like postpartum confusion and overwhelm, and they want to breastfeed, but they want to take the easiest path. And those are the challenges. Those are the ones mom herself needs craniosacral, right? And I always hope for that and send them that way.
Yeah. And we find that, just like you mentioned, sometimes some of the babies, or the current concerns for the baby, resolve as the mother gets her own body work.
Yeah.
As she starts to resolve perhaps her relationship or her beliefs around how her pregnancy was,
Mm-hmm.
how even conception was, and how birth was.
Mm-hmm.
And those things all play a role in how even a baby feels, their nervous system, right?
Mm-hmm.
If they're stuck in that fight or flight because the person who is
Mm-hmm.
supposed to make them feel safest is also stuck in fight or flight, or
Yeah.
is also reeling, right? Their memories are just on repeat and reeling over
Yeah.
and over again, then this baby is going to have a really hard time kind of down regulating because their
Absolutely.
person is not down regulated.
Mm-hmm. I start many of my in-person consults with lowered lights and mom and baby skin to skin. And, mom is, if they're in that state of wound up
Mm-hmm.
and let's do, I'll be like, they're
Mm-hmm.
like, no, we're going to latch. No, 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 we're not going to latch the baby. We're going to
Right.
sit here and we're going to breathe. And I want you to close your eyes and take some deep breaths. And when you exhale, relax your shoulders and do that 3 times. And we sit and we start talking very gently. And almost always that baby will root and latch, even if they've never latched before. Like, I just hold space for them
Mm.
because nobody has yet.
Yeah.
And if anybody's listening who's in this field, try this. It's incredible. When I worked in the hospital, it was a little bit, less peaceful in the hospital environment.
Mm-hmm.
But
Mm-hmm.
I would go up on the postpartum floor and the nurses would give me a list of, oh, the woman in 2 and the one in 3 and this one and that one needs you. And I would go up, I would start at the beginning and I would get them all skin to skin if that was, if they were able to do that, and go down the line doing that and then go back around and see if anybody still needed help. It was incredible because half my work was done for me just by that baby and the mom, and giving the mama and the baby just permission to be together. And I'd say, don't
Yeah.
try to latch the baby. Just be with the baby. Talk to the baby, whisper,
Yes.
relax, and breathe.
Well,
And
especially at that age, right? Like that soon after, they are solely mobile
right.
on reflexes.
Yeah.
Infants are,
Mm-hmm.
right?
And they're programmed to go do that
That
thing.
is all they know.
Yeah.
I mean, you watch, I like to watch the videos of panda babies. They are
Mm-hmm.
tiny
Mm-hmm.
and they know exactly where to go and how to get
Mm-hmm.
there. Babies are the same. Our babies are
Yeah.
the
If
same.
we get out of the way, they know what to do.
Yes.
And
Yes.
especially after a confusing and eventful, let's just put it that way, hospital birth, and all the things
Yes.
that happen, and the separations that may go on, and the excitement and the adrenaline going on, just to get them back centered. And
Yeah.
to bring this back around, I feel like, from my point of view, craniosacral does that for the mom and baby
Absolutely.
pair. You know, and I think
Absolutely.
that that's what's beautiful about it. It's one of the hands-on, and I think that energy is important, and your hands energy on that mama or baby is really healing too in
Yeah.
a certain way. That's where I feel like the woo-woo comes in too.
So I love that you mentioned that. And because a
Mm-hmm.
lot of people associate energy with woo-woo,
Mm-hmm.
right? Like, oh, energy isn't real, it's just your
No, it's
imagination.
real. Yeah.
But it's so real. Like you turn on the light, that's energy,
Mm-hmm.
right? The wind turbines, like that's energy. It can be converted into energy. Um, a balloon giving you a static shock, like
Yes,
that's energy.
absolutely.
You rub your feet against the carpet and you touch something metal and you get a shock. That's energy.
Mm-hmm.
We are energetic beings. Literally, you blinking your eyes is energy.
Mm-hmm. Just
Uh,
breathing.
it's
Just
breathing.
breathing. Yeah.
Breathing, your heart beating is energy, because it's electricity, right? Like our heartbeat is literally an electrical pulse.
Mm-hmm.
It is a shock. I'm snapping my
Mm-hmm.
fingers if you're wondering. It is a shock. And so that's why they shock your heart back into rhythm if you have a heart attack or
Mm-hmm.
arrhythmia. Um, and because we are electrical beings, because we are energetic beings. And so we can also have intention with that energy. We can have a negative in intention or we can have a positive intention.
Mm-hmm.
And if I don't know, not everyone believes that you can talk to a plant and then the plant receives positive or negative energy, but they are scientific evidence
Mm-hmm.
that a plant can changes with negative and positive energy
Mm-hmm.
or intentions, let's say. And generally speaking, with CST, our intention is always for the best of that person, whether it's our own projected thought of what is best or whether it is allowing this person to help us set the intention of what's best for them.
Mm-hmm.
And a good CST provider will not project their own intentions or their own desired end results. They will allow the intention of that person or allow the desires of that person who is receiving care
Yeah.
to set the intention.
That's beautiful. And that's like a softer way of the way I say, I'm not here to make every mom breastfeed. I'm here to help every mom meet their own feeding goals.
Yeah,
Right. So like
that's it.
you're not, would I love for everybody to breastfeed? Yeah. But I'm not going to force anybody into it. And you're not going to force anybody in quotes to do what it's not ready to do. Right.
No,
It's a different way to say a similar approach to that, allowing that. It's just beautiful. It's a feminine approach, in my opinion. It's a feminine approach.
I agree.
And I've been focusing more on modalities, and this has nothing to do with man or woman. It's just a softer approach to life and to therapy and to taking care of people, of more of a, instead of a go approach, a more laid back and let it happen approach, which that's why I consider it more feminine.
Yeah.
Um, and yeah, it's beautiful. So Meaghan, we've talked a lot about CST. I want to hear a
Mhm.
little bit about what you actually do now in the world, because we have similar. We were talking before we hit record about how we're both women entrepreneurs. We both operate our own businesses. I sell courses to professionals and I do the podcast. And tell me about what you do so my audience knows how you can be of service to them.
Sure. So I myself, I'm a registered massage therapist up in Canada.
Mm-hmm.
Um, and I'm also a craniosacral therapist. I'm a rhythmic movement specialist. I do visceral manipulation. I love the human body. So my own private practice, I generally just treat babies and children. sometimes teens, and then also usually the moms, but also sometimes dads of the babies who I see in my care. So I generally use a whole spectrum of care, the different modalities in my sessions, between rhythmic movement, visceral manipulation, craniosacral therapy, and I love it. I'm actually obsessed. But I knew that there needed to be more of me. I was a sole provider. I was the only person in this company that I was working, that I produced, I made. And I was run off my feet because there was just way too many babies to treat. And I knew that there needed to be more people like me in the world, that if I was feeling this way, a lot of other families were feeling this way, that, providers were scarce. So I decided back in 2020, do you remember that year? That was a fun one.
Yeah, I kind of remember that year.
Do you remember? I mean, it's very vague. But back in 2020, when after the first lockdown, we went back to work, and I was 5 days a week, which I had only been working 4 days a week previous to the first lockdown, 5 days a week, 8 babies a day. And I was like, I can't do this alone. I need more people. So I wanted to train people to come work for me. And I did that. I created a curriculum where I basically said, this is how I have found benefit and what works the best. And so I created that curriculum in 2020, and I started teaching in 2021. And so now I train health professionals. Majority of people who come through this program are health professionals who are already working with babies or who want to work with babies, how to do craniosacral with a bit of fascial, like visceral manipulation integrated into it, how to do that for newborns, even all the way up to 1 year. And so I do this both virtual and in person. So the virtual course is the introductory course. So it's very basic. It's very much just how to treat the body, how to find the beginnings of how to be an infant craniosacral therapist. But then to actually become an infant craniosacral therapist, these people who have finished level 1, which is the virtual course, they need to move on to level 2. And the majority of those people are like speech language pathologists, IBCLCs, midwives, doulas. They are occupational therapists, physical therapists, massage therapists. And those are the ones who are going back and doing the majority of their practice as a craniosacral therapist. And
that's in person because you need hands-on, right?
You have to have the hands-on.
Yeah.
The basics of the body is very beneficial. I will not throw that stuff out and be like, oh, it's nothing, because it's not nothing. It's very foundational in that treatment.
You need that foundation to understand.
Absolutely. Yeah. But the reasons why I teach that virtually is because I wanted to take away barriers, because I know that there are so many people who want to learn this, but for them, spending that money and taking time away from their family to come to Toronto is not possible. So now this, the basics, the foundations, just the very gentle touch, the do no harm of the body is taught virtually. And then the hands-on in person is for the cranium. So the people who are very serious about, I want to treat babies who have tongue tie or possibly no tongue tie, but I want to be able to help them decipher whether they do or not.
Babies with dysfunction, you're gonna be addressing. Yeah.
So because they're touching their head, right? And so I can't be like, oh, you're doing a great job, touching a baby's head virtually. I can't teach that.
Right. So I love that you're doing this work, and that's where when we booked this podcast to have this interview with each other, I didn't realize how much we had in common, but I was the same. I was seeing honestly, on social media, because I'm very involved in Facebook support groups, and especially in 2020. very involved in Facebook support groups, because, and also other types of support for families virtually, and during the shutdown. And I was hearing of horror stories or things that weren't handled the way that I've honed my expertise in such a way that I know works for the babies in my care. And I said the same thing. Let me teach other providers what I know. And not just, as I said before, not just lactation consultants, because we all need to understand this. Yes. And the same way you're saying, oh, you don't have to be a physical therapist or an occupational therapist to do this. As long, we open it up because we need to break down those barriers. We need to stop learning in silos. We need to understand what each other understands. And mine is definitely focused on breastfeeding babies. Although in my professional membership, we bring it a little bit more out to older kids, but that's not my expertise. But I'll have guest speakers and stuff like that. But I've done the same thing. My course is literally everything that I do, I poured out into my course so that people can learn what I do and how to do it in their own communities and make it accessible because it's all online. And it's such a thing that as I honed my skills and things changed for me, last year I redid the whole course because I was like, wait, I'm not teaching this in the course. I'm teaching what I did 2 years ago. And I've changed things based on evidence. So let's redo this. And I was so excited because, when you start feeling as something might be stale and you're like, I don't want to stand behind something that's not exactly what I'm doing now. So I redid the whole thing.
I am actually I am right in the middle of that right now.
Yeah. And
it was 2021 when I created level 1. And so now it's time to
you evolve, right?
Yeah, absolutely.
Yeah. And especially because there's more and more evidence, there's more and more research coming out about tongue tie, no matter what the naysayers are saying, it's there. And I've done a couple of podcast episodes about research because it is there. Maybe it's not the perfect level 1, but so much of what we do in medicine is not based on level 1 research. I don't know why the standards are held so high in this subject area, whereas even in OB, there were things I was doing when I was a nurse in the labor and delivery room that weren't even FDA approved. Do you know that Pitocin is not FDA approved as an induction agent, or it wasn't when I was practicing?
Oh my gosh.
Why are we held to such a standard of look at it. It's amazing? Crazy. It's crazy. Anyway.
Also, we my heckles are up right now.
Yeah. Mine are always up. Okay.
Because I was like, craniosacral is frowned upon by so many people, and it is non-invasive.
Right.
And it's called pseudoscience. And I think, what the hell?
Right. It's because they're afraid of us. I mean, getting back to the feminine energy, right? So this is what I like to, as a midwife, the first midwives were hunted down as witches.
Absolutely.
Right. They're afraid of our power, right? Society. And I hope I'm not pissing anybody off by saying this, but
probably are, but that's okay.
That's okay. We historically, people have been afraid of the power of women.
Yes.
Right?
That's why we are repressed.
Yes. And we stand in our power, and it makes people nervous. And there's room for all of us. We need the medical system. We'd absolutely need it. We're not throwing that out. But maybe we can avoid medical treatment if we used a little bit more of the feminine energy and the healing arts instead of just the Band-Aid arts. But anyway, that's a story for another day. I'm going down my other side of my practice rabbit hole where I practice functional root cause medicine and all that stuff. But that's a story for another day.
I would like to ask you a few questions.
Sure.
So what would you say makes up the most of your online courses?
The most of my online courses is my professional's guide to tongue tie and the breastfeeding infant. That's like my complete course that goes through everything from assessment to what I call treatment plans, networking and team building, which to me is the core
That's
of my
huge.
practice.
Yes.
And then recovery from procedure or treatment, like ongoing care.
Right.
I go through all the, as many assessment tools that I could find currently in 2024, and did a critique on them, what's good about them, what's bad about them, because there's a lot of confusion and miscommunication between providers about assessment. Like who's calling it a class 1, who's calling it a class 4. And I don't even think that matters so much. It's more about the function and talking about the function. And then what other treatment modalities should we do first, and how to educate. And I have a complete, I call it the education bundle of all of the handouts. It used to be handouts, now it's downloads, that I have crafted over the years, my years of practice, that I was giving to my in-person patients, depending on what their needs were. And I put this into a bundle, and that's part of the course, but it's also something people can buy on their own. So instead of you trying to make a flyer that says, these are the exercises you should do before, it's all there for you. Or
Oh, perfect.
I have one of my most popular ones is questions to ask a provider if you're going for frenotomy. How do you know you're getting a good provider? And there's questions to ask and look for the right answers to know that they're knowledgeable. And preparing. And preparing for me is not just do exercises in the baby's mouth. Preparing is as minute as, what are you going to feed your family that night? Like, get that, I go into like, have the medication, the analgesia that the doctor is going to prescribe at home already. You're not running to CVS or the health food store when the baby's crying and it's 7:00 at night. So really preparing
Yeah.
because I know from a common sense, practical standpoint, this is where the families in my care have struggled. And I'm
Yeah.
like, let's spell this out. This is what you need to do before. So that's part of what I do. And then, of course, I have the Tongue Tie Experts Insiders, which is a multidisciplinary membership group. We have a private group where we could talk about cases, and we can vent to each other. We tell our successes. We ask questions to other providers. This is where it's beautiful because I can say, hey guys, I have this baby. Do you think this baby needs CST, or maybe I should send it to whatever, or we've done this. Now what should we do? If somebody's struggling, especially if there's new providers who don't have a team built yet, this is a great way. And that's a private membership group. And once a month we have a Zoom meeting where I don't hit record, and we chat so that we can have private conversations. And then we hit record, usually have a presentation either by myself or another provider in a different field. And then we chat about it afterwards as well. So I also have a milk supply course for those who don't have experience and haven't really learned about how milk supply works, so that they can feel comfortable counseling their own patients if there's struggles with milk supply, whether real or perceived, because many of the women who stop nursing because they think they don't have enough milk actually have plenty of milk. So we go
Yes.
through all the risk factors, how to know. That's great for people like chiropractors, PTs, OTs, those who didn't get maternal training, So
Yeah.
it's an umbrella, but the pro course is my jam. That's the like the icing on the cake. It brings it all together.
That's amazing.
Yeah.
That is a lot of information for a lot.
Yeah, it is. It is. And I've been told that I teach too much. Like I could break it up and make it into smaller courses, but I can't separate what I know. It's like,
For sure.
I feel
For
like
sure.
anyone doing this work should know all this stuff that I've
Yeah.
learned over the years of experience.
Yeah.
And years, I mean, some of my students weren't even born when I started, as a nurse. So I've had patients come to me that I took care of them in the nursery when I worked in the hospital. I've
That's
been doing this
amazing.
for a really long time. Yeah.
Yeah. Yeah.
So,
I mean, that is a wealth of knowledge, though.
yeah.
I think the people who take that course, if they aren't using all of it, then they're probably missing out on a lot.
Well, everybody takes what they need, and they can refer back to it, and the group is there. So
is it like lifetime access or is it? Yeah. Oh, nice.
It's lifetime access as long as it's my lifetime access. That's
for
what I
sure.
like to say, right? As long as I can keep the platform going. And if you do get, if you're a lactation consultant, you get LSERPs and RSERPs, which is credit for lactation. And I can only promise those a year at a time because of the way the accreditation system works. So you have to get the credit within a year. And then after that you could, or have me, I can't promise that after a year I'm going to get reaccredited, even though there's no reason why I shouldn't, but I can't make that promise legally. So there's a lot of stuff that goes into getting credit for lactation, but I try my best.
I know it. We just put our programs through it. So
really, that's great. That's great.
So we are also approved for
excellent
for SERPs. Yeah,
that's fantastic.
Yeah, I know. I'm really happy about it.
It's a big deal.
Yeah.
A lot of behind the scenes stuff happens in businesses like ours that other people would not appreciate the effort that goes into it and the celebrations you want to have afterwards, right?
There is so much that goes into it.
Yeah, but it's so worth it.
Do you have people working for you as well? Or are you doing this all on your own?
I just have a podcast manager who helps me post my podcast and edit, somebody who edits for me. And I have a someone who's like my VA.
Wow.
And that's it. Everything else is just me because I'm a control freak.
I see what you mean. I am also a control freak, but I can't do this on my own. I have lots of people who work for me.
Yeah, that's great. Yeah. That's great. Yeah, I'm that's one of my goals of 2025 to start trusting other people to do some of the work for me.
Yeah. I think this is like one of my favorite things, but I think that if you know how to train professionals on how to do tongue tie, you can also train someone how to do what you do.
Yeah, you would think, right? How to write an email or something like that.
Absolutely.
Anyway, Meaghan, this has been a total joy. I don't want to take any more of your time. We said a half hour to 40 minutes and we're talking for almost an hour. And I think we could probably go on for a couple more.
Absolutely. So do I.
So we'll have to get together again this way or hopefully in person someday.
Absolutely. Thank you so much for having me.
Okay. And I'll put in the show notes where we can reach you, your website for your courses. Beautiful. And we'll talk soon. Thank you so much for being here.
Thank you for having me.
Thank you so much for listening to this week's episode of the Tongue Tie Experts podcast. Check out the show notes for useful links about the topics we discussed and for ways to follow us on social media. Please subscribe to us on your favorite podcast app. And if you enjoyed listening, we'd love it if you'd rate, review, and share with your friends and colleagues. Thanks so much. Bye-bye. Tongue tie cases can be confusing, but what if you had a place to ask questions, learn from experts, and connect with professionals who truly understand? That's exactly what you'll get when you join Tongue Tie Experts Insiders. It includes monthly online meetups with me, Lisa Paladino, expert guest speakers sharing the latest research and best practices, a private community of other professionals ready to support you every step of the way. For just $19.99 a month, you'll never have to navigate tongue tie cases alone again. Join the community today. Your future self and your patients will thank you. Sign up now at tonguetieexperts.net/insiders.